Dr. Darien is with us talking about febrile seizures.
Yeah.
What is this and when do people come to the emergency room?
So a febrile seizure is any time a child, can happen between the ages of 6 months and 6 years old, has a seizure while they're having a fever. Now that can be any temperature above 100 degrees, 100.4 degrees Fahrenheit. It is something that I've witnessed many a times as an emergency physician, and understandably, it can be quite traumatic to witness as a parent.
I can imagine, but what do people need to know to tell themselves that it's okay? You were saying in the break, it doesn't really scare ER doctors because you know what's going on, but doesn't mean that it's not terrifying to the parents and even the children.
It can be terrifying. You know, some of the things that you want to do is, number one, be prepared. Understand that when a child has a fever, any child, 1 out of 20 children actually, can have a febrile seizure, a seizure while having a fever. So in the event that that happens, you want to make sure that you lay that child on their side, you protect their head, and avoid putting anything in their mouth. Sometimes you feel the desire to do that because you think maybe the child is choking, but that can increase the risk of choking. And then if that fever lasts longer than 3 to 5 minutes, you should certainly call 911. Any febrile seizure, you should contact the doctor. And then once that child is awake, they'll often have this what we call post-ictal period, where they'll be a little confused. Once they are back to their normal baseline, you want to give them medication to bring their fever down, because at the end of the day, that was the main cause.
And is this something that means like they could be having seizures for the rest of their life, or is this a one-time thing?
That's a great question. The question of whether or not my child will get epilepsy, which is a seizure disorder. Now, although there is a slight increased risk, the overall chances of this affecting their brain permanently or leading to a seizure disorder are still low. So thankfully, these are problems that are likely isolated. Just being calm, remaining calm, laying that child on their side, and protecting their head are really important.
All right, Dr. D, thank you so much for that.